I'm Dr. Edmund Sulkowski, and welcome to Healthy Pets, Healthy Owners. I'm excited about today's show. We have my friend and Peters Township chiropractor, Dr. Scott Anderson, on the show today. Dr. Scott, welcome so much for coming onto the show. I know you had to arrange your schedule to appear on here, and I thought it was so important for you to come back. It's been a while since you've been on.
Yes, thank you.
And you have so many important things to talk about, and a new procedure that I think can be very helpful to people that we're going to get into in a little bit. So, Scott, you've been a chiropractor for how long?
25 years.
I didn't want to age you here, but
yeah,
that's a long time in the profession, and I'm sure you've seen a number of changes over time from what you were taught in school to now. Can you identify some of those things that have changed for us?
Well, a lot of people just used to do the manual adjusting, and the cracking and the popping noises would occur.
Old school chiropractic care.
Yeah, and I still feel there are people that absolutely love to be adjusted that way, but there are techniques out there now that are less invasive, and if you're absolutely afraid of being manually adjusted, there are a lot of techniques that I use in my office that are, I actually use them on a 3-month-old baby all the way up to a 92-year-old woman.
Now, I have to identify to everybody, not only my friend, I'm a patient as well, and I see those high-tech devices that you have in your office that I don't see in a lot of offices, and I don't see them widely used. You have some really unique new equipment.
I try to stay up with whatever the latest is out there because I feel that some things, with time, you should be able to update your technique, and some people are looking for those techniques, and if you don't have them, they're going to go somewhere else where they do have them. So I try to stay up with all the latest, and including the cold lasers and the adjustment tools that patients they do their research, and that's what they're looking for. So I try to have everything in my office.
I know when I've come as a patient to your office, you've done some electric stim before we even begin the adjustment process, and then you end up with this cold laser. What is this stim, and then tell us what cold laser is.
Well, electrical stim is a device that I use the interferential stim, but it basically releases your body's own enkephalins and endorphins, which will help the pain be relieved. So it does feel good.
It's kind of a little tickling pulse is what it feels like.
Yeah, so it's just a technique that it's been around for years, and it does relieve some of the pain and inflammation. And the cold laser has actually been around for some time, but there's class 4 lasers and class 3. Class 4 gets very hot, and you have to wear glasses, and patients could be burned if you're not using it correctly. I use a little safer method. It's the same effect happens, and it basically is used to remove inflammation in the body.
And where there's inflammation, there's disease. Where there's disease, there's inflammation. So that's a constant battle that we have.
Correct. Yes,
and
I agree.
If you're misaligned, it aggravates that battle. So tell us what all that alignment and misalignment is, and what the medical terms are.
Well, as a chiropractor, we are trained to find where the nerve is being pinched and where the vertebrae is being misaligned. But a lot of people don't understand that. Say you wake up with a headache, that's usually a hypoglycemic or a chemical imbalance in the body, which will then cause the subluxation or the nerve to be pinched.
So that term subluxation means pinched nerve or misalignment?
It can be both. Usually the misalignment will always pinch a nerve, but there can be indications, that the misalignment could actually be causing you to have acid reflux or a stomach ache or
and there's actually
earache.
A procedure to alleviate that acid reflux.
Yeah, that is a very common problem that people are having right now is indigestion, acid reflux, irritable bowel syndrome. Those are all techniques that I'm trained in to help the body heal.
One time I was asked by somebody if I believed in chiropractic care, and I said absolutely. When I was young, I remember my father going to a chiropractor when his back would go out and so forth, and I'd hear bad noises and yelps, and because they were doing that old style technique, and I remember watching him being put in almost like a bear hug and looked painful. And I would never go to a chiropractor. But for the last 15 years, 20 years almost, I go, because the techniques are different, and then I see improvement. I remember a couple times I moved funny, made a misstep, threw my back out, and I didn't go on pain pills, I didn't go on ASEDs. I came to Dr. Scott, and you adjusted me over a week or two, and that pain totally went away, and I could walk again, you know. And it doesn't take much to throw you out of chiropractic care. So when out of alignment.
Yes, I agree.
So I believe completely in chiropractic care. So somebody asked me one time if I did, and I said, well, I look at it this way: we're nothing but a electrical tube, a hose basically. And if you compress a water hose, nothing flows right, and you have all kind of problems. And we are a tube from here to there, with nerves and blood vessels. If any of those kink, you're in trouble. Would you agree with that statement?
Absolutely. It's funny that you say people ask you if you believe in chiropractic. It's not a religion. It doesn't need to be believed in. Chiropractic has worked from the beginning since we originated. Our premise has always been just to remove the pinched nerve, and we've never changed. And over 100-some years now, that's the premise, and we've always stuck to it. So to say, if people come in and say they believe or don't believe, chiropractic works whether you believe in it or not.
I think the old stigma from the medical world, which I think is leaving tremendously now. I think you'll find some older people that still have that chiropractic is bogus. You know what I mean? They still believe that. But people in the know, and I think younger people, are really realizing that our body needs to be in alignment or we're in trouble. And it happens from delivery on, doesn't it?
Yeah, actually, that's what the Nasal Cranial Release is actually how it started. In the 1930s, Dr. Stober noticed that when the cranium was coming through the birth canal, it was being compressed, obviously, because that's how it gets through. But when it came back out, some of the cranial sutures and the cranium wasn't realigning to its proper alignment. And so we're going to get into that. But yeah, right at birth is one of the most traumatic experiences you're ever going to have in your life. And that is the most common time for a vertebrae to be misaligned and a problem to start right at birth.
Well, people don't realize that delivery system actually creates a compression of all your facial bones, and you'll often see, if it's never corrected, and you do chiropractic adjustments on infants and newborns.
Yes.
If that's not corrected, you can have two different profiles. So straight on you look similar, but if you take profile pictures, it's almost like two different people because that compression happens and it doesn't go back.
And they are able to look at people and see if that is balanced, and if it isn't, there's almost always a neurological problem or health problem related to it.
Yeah, because there's some type of compression of something somewhere.
Yes.
And it doesn't get better on its own, it gets worse.
And that's how the nasal cranial technique was actually originated and developed to fix that problem.
So we're going to go into depth during the show about nasal cranial release, but I want to get a little further background. What prompted you to become a chiropractor?
Well, originally I had a tear to a cruciate ligament and a meniscus in my knee, and the doctor that happened to be on the work comp staff at Nemacolin Woodlands, I was working on a golf course. I was ready to go to medical school, and when I went to him, he said, well, why are you going to medical school? And I just told him I had a background. I'm a licensed funeral director and embalmer. And I thought that background would be good for me to be a pathologist. He explained to me that maybe you did need to have the surgery. And I told him I don't want to have the surgery. And he adjusted me, adjusted my knee. We did rehab, and that was in 1990, and I still haven't had surgery on this knee with an ACL tear and a meniscus tear.
Yeah, I have a bad knee. It's had 4 or 5 surgeries on it, everywhere from a medial meniscus to broken kneecap, and I was told that I would have by the physicians that did the surgery that I would in 5 years need an artificial knee, and that was when I was probably 22 years old. And when I was going into the Air Force and they were looking at my scars and past surgeries, they couldn't even find the hairline fracture. I had a full fracture with a pin in it, and that pin had to be removed, and they couldn't even tell that I had a fracture in my knee.
It's amazing how the body can heal.
You do the right things, the body will heal. We tend not to do the right things. One of the things that I did was I was an avid swimmer, and I would swim 4 or 5 miles a day. and I built up those quads that took the pressure off of that knee and allowed it to heal.
Great. That's all you have to do sometimes.
Yeah, so you don't always like have to accept the diagnosis that you're given, you know.
I agree.
And it's not, that's what, you know, this show's about, is being in charge and being educated and looking at some alternatives and see if they apply. And I look at chiropractic care, you know, I even have it done for my dog. I've had them for all my dogs over the years. I look at that as an important maintenance feature, because when you're compressed, you're not right, and nothing works.
Well, yeah, an animal has a spinal cord and spinal nerves just like we
They're
do,
no
so
different.
they need adjusted, and my dogs get adjusted once a week.
Yeah, well, they got a dad that they can do that to them. Actually, Dr. Scott taught me how to do it, so I have the instrument, and I do that I did it on all my dogs, and still do it on Tucker. So I think it's an important technique for functionability and quality of life.
Absolutely.
So your office is located in Peters Township.
Yes, I'm right across the street from the PNC Bank, right up from Donaldson's Crossroads. Beto's Cucina restaurant is right beside me. I've been in the Palm Building and in McMurray since 1998.
Yeah, you've been a staple here as far as chiropractors in Peters Township. And I know you're an animal lover as well, and you know, we do some shows on animals and some shows on people, and you and your wife, Nicole, have Pomeranians?
Yes.
And you're good mom and dad to these dogs.
They're spoiled rotten.
They're spoiled rotten.
Those are our kids.
Yeah, absolutely. Yeah, and they deserve it, you know. So, are there chiropractors out there that are able to adjust dogs while we're on dogs?
There are 3 or 4 chiropractors that are considered animal chiropractors. In the state of Pennsylvania, as an animal chiropractor, this law is being fought right now by some chiropractors, but the law states that you have to be under the supervision of a vet while adjusting. And right now that law is being challenged because there are several states in the United States that once you're certified as an animal chiropractor, you can just have the animals come to your office and they can be adjusted. However, in the state of Pennsylvania, the laws right now are stating that you have to be under the supervision of a vet, which I do not agree with.
Yeah, well, I used to go to veterinarians' offices, and do the dental surgeries on dogs and so forth. I couldn't bring the dog into my office and do that work, but I could go to under the supervision of a veterinarian and do that work. Yeah, so it's interesting. I personally see Pennsylvania as a little bit of a backward state, full of bureaucracy and so forth. But hopefully that'll change.
I hope it does too, because I would love to go and be able to travel and adjust animals if I'm out and about on the road. I think it should just be universal, like chiropractic now. Once you've passed your national boards, you could adjust in any state. It's the same with MDs, and I think that should be the same with animal chiropractors.
Yeah, and you went on to further training to be licensed certified to adjust animals.
Yeah, I mean, you could get trained in what's called it's an adjustment tool. It's the actual doctor that trains that was an osteopathic surgeon. He's a veterinarian surgeon, and he saw that none of the animals were having a successful recovery, and he decided to go around the world and train people using the adjustment tool and how to adjust and train chiropractors and vets in animal chiropractic.
And that's horses, dogs, cats?
Any animal that has a spine.
Yeah.
So it could be a mouse, could be a whale, could be a dolphin. He actually adjusted a dolphin before.
And you get, what I know the term from you are reads. So you can actually see when you manipulate an area that's a deficient area.
Yes.
Even without any type of diagnostic x-rays or
yeah, they have a reflex setup that we don't as human beings, so you can instantly tell where the misalignment or subluxation is on the animal.
Yeah. So what symptoms would I have that would tell me I need to get in for an adjustment, other than the obvious pain? Yeah.
Sometimes you don't have any symptoms at all. That's the scary part. But if your body's stressed out, there's usually an underlying problem causing that stress. So it could be anxiety, it could be a sinus infection, it could be an earache, ringing in the ears. Diet, yep, absolutely.
So if someone has high blood pressure, is it possible that their high blood pressure is a result of a misalignment?
Absolutely.
But medical science doesn't look at it that way.
No, they don't. Everything is related to the spinal cord. It's actually the first thing that forms is your spinal cord and the nerves around it, and then the bones that protect the spinal cord. It is the very first thing that forms in your body, so it would be pretty important to make sure that those vertebrae are aligned.
The next time you come on, I think you need to bring a model of a spinal cord, because I don't think a lot of people really are aware the intricacies of all the nerve bundles going up through those vertebrae.
Yeah, I would love to do that.
Yeah, that'd be interesting. So you have a skull here, Dr. Scott, and it's a replica of a skull.
Yes.
And why did you bring that in?
Well, I wanted to show people, because they always are wondering, well, what happens with the nasal cranial release? So basically
This is a technique, and you're one of the few people in the whole country that does this technique.
Yes.
So what's the purpose of, it's called nasal cranial release.
Yes. The purpose is mostly is if you've had a concussion, the impact upon your head has caused these cranial bones and these sutures to misalign, and if that is happening, the spinal fluid to your brain is not moving as it should be.
So anybody that's had some type of concussion should immediately be doing this procedure.
Absolutely. The longer the concussion stays, the harder it is to fix, the more signs and symptoms that the patient will have. Either that be headaches, a vision problem, vertigo, memory loss. Those all can happen from a concussion.
I was just talking to someone last night who was in a car accident, and she was telling me that she has the symptoms of a concussion. And it's exactly what you described.
Yeah, car accident, a lot of people don't think that you can get a concussion.
She didn't bump her head, you know. It wasn't a strike on the head, but I think she was hit from the behind, and I think the force of the brain moving in back and forth.
Yeah, that is something that is explained in my office, that whenever you are hit from behind, if the car was moving, the person inside the car receives the impact of the other car. So it's very easy to get a concussion. The jaw gets misaligned, TMJ can come about from that. So if you get this impact relieved and it moves, then the spinal fluid will go back to its normal flow and the body will go back to its normal stasis.
So how long does this procedure take in the office?
So that's a good thing. It really only literally takes a couple minutes for the procedure to be done.
And how often do you have to do it?
Most of the times, 5 to 6 treatments will completely restore the cranial bones to its normal.
Because what people probably don't understand is all these cranial bones have these sutures. They're in pieces and they move.
Yes, they actually move your entire lifetime. A lot of people think when you get older that they completely fuse, but they never completely fuse. They move 1/100th of an inch each time you breathe in and out.
And that's the same for the sinus bones, the
yes.
ethmoid and
the
so forth.
The sphenoid and the nasal pharynx all moves.
Yeah.
So the procedure is the finger cot is put into the turbinates. There's 3. There's the lower, middle, and upper, and it is inflated and released. When this goes into there, it actually pushes on the nasal pharynx cavity, and it will remove the suture that is compressed.
So is there pain involved in that?
You only feel pressure of the ball being inflated.
So like a stuffed sinus or something?
Yeah, there's no pain related to it. It's just a pressure.
And you don't need anything like a type of anesthesia or anything like that before?
Nope.
Is there any prep that you have to do before the procedure?
No, there isn't any prep. The patient lays there, and there is some lubricant put on the end of the cot. It's inflated. I do 3 sides and then back down into the lower turbinates, so it actually literally only takes a few minutes.
And how many, you said 3, 4, 5, 6 sessions before, depending on the severity of the issue, but how often do you do those? Once a week, or every couple days?
Yeah, once a week would be fine, depending on the person. I've had people that were fixed after the first time that it was done, like students or athletes that came in, they got hit with a softball or got hit with the volleyball or had a concussion, and instantly their vision was restored and their headache was removed. But some people, the longer the concussion has been there, the more visits it takes to fix. If you came in the day right after you've had the concussion, it may only take 1 or 2 visits, as opposed to if it's been there for 2 or 3 years.
Amazing.
Now, I've done this on myself probably close to 100 times. I've had 7 concussions that I know of. And once the adjustment has been made with this, it stays. Like, it doesn't revert back to going to its old ways. So once it's done, it stays, and then it improves and improves with each time.
So this is basically a chiropractic adjustment for the sinus cavity.
Absolutely. That's the technique.
Kind of amazing. How did somebody come up with this idea?
In the 1930s, an osteopath saw when the baby was coming out of the canal, they noticed that 90% of the time the head will come through and then it rotates to the left and goes through. So the whole left side was constantly being concave. And if you look in somebody's nasal terminates, almost 90% of my people have a decreased on their left side than on their right.
So if I was getting constant sinus infections or had constant drainage, that could be a sign that I need this procedure done.
Yes. Vertigo, headaches, pretty much any time that you've ever hit your head, you have probably concussed, or at least caused one of these sutures to misalign, which would affect the flow of spinal fluid up into your brain.
You know, I was a big roller coaster rider, and I would go wherever there was a roller coaster, I was on it. And I would get headaches after riding some of these roller coasters, which I knew was my brain being jumbled up and swelling a bit. So I would do this was back in the old days when I wasn't as holistic as I am now and know what I know now. I would take some type of NSAID before.
To preempt.
Yeah, so that the swelling was kind of addressed before it even happened. So it takes a little bit of trauma, even from a roller coaster, that can cause an issue like this.
Oh, absolutely. The bumper cars in Kennywood, which that is probably the first whiplash you've ever experienced in your life. Because what did everybody want to see if they hit you from behind? If they saw you do that, they thought that they got you good. And that was actually a whiplash. There have been people that have become paralyzed from, unfortunately, riding the bumper cars. But they've slowed the cars down, and they've put the seats up a little higher to try to fix that problem. But in Pennsylvania, I don't know too many people that haven't slipped on the ice and fallen and landed on the tailbone, and then the head will whiplash back as you're trying to catch yourself. So that's another common area to get whiplash, and a lot of people, when they land, they hit their head.
Absolutely. And then I think sometimes just a misstep off a curb or a step can do the same thing.
Absolutely. So there are a lot of people that, that play sports that get concussions. There are a lot of military people that get concussions. And
I had the experience, I was wearing a ball cap, and I made a turn and didn't judge the wall and hit the, whatever you call that part that sticks out of the ball cap, knocked my head back. I got a headache afterwards.
Yeah, I mean, it doesn't take much to concuss, and a lot of people think it has to be a hard hit. You can be getting into your car, and I've sometimes not ducked low enough to get into the car, and I've hit the top of the car or that, and instantly got a headache, and you probably got a light concussion, mild concussion, just from doing something like that.
And a concussion is basically a swelling.
Yes, the brain actually swells. So a baseball, a volleyball, a basketball, if you've gotten hit with that, you probably have concussed.
So a lot of people that end up going to a coma after a head injury, it's because of that swelling of the brain.
Yes, it should be fixed, and it can be fixed using the nasal cranial release.
So you do the nasal cranial release, and you're probably the only person in this area that's doing that.
Yeah, Cindy Stein was the one that taught me, and she's moved out of the state, but she travels to Dubai. She travels all over the world specifically to train people in this technique.
So that you then combine this technique with a regular spinal adjustment?
Yeah, I am trained in sacro-occipital technique, so there is adjustments that you can do on the cranium. And obviously, if the cranium is misaligned or concussed, the body will try to overcompensate for that. So you could start walking differently, you could start thinking incorrectly, you could not be able to concentrate fully, anxiety can come about, depression, all these things can come about just from a misaligned cranial bone.
Even your bite can go off as a result of something that's impacting this.
Your bite there's a lot of nerves that run through the TMJ, and I probably find 8 out of 10 people that have a problem with their jaw.
Yeah, it's often misdiagnosed or underdiagnosed.
Yeah, and I do a lot of TMJ work and adjusting inside near where the joint is in there, and the internal and external pterygoid muscles, which move your jaw from side to side, get very tight, and if you release that, it'll fix them.
Yeah, what people don't realize, when we chew, we don't do this. We do this. It's translation.
Right.
And so
It's
we're
like a
doing
grinding.
like this. Tucker, on the other hand, when he chews, I woke him up right now, he just goes up and down. He's unable to translate. So he really doesn't chew.
Correct.
You know, so there's so much involved with muscles and nerves. So I think it's so important that those things be in the right form.
Especially if it's going to affect your memory and your ability to concentrate and focus. You know, that's what, if those nerves are not talking correctly and there's a blockage, then the body can't do what it's supposed to do.
Send a message.
The body is sending messages constantly to tell you if there's something wrong. And usually that's the person that is in excellent condition, they're running, everybody thought they were healthy, and they had a heart attack. They obviously weren't healthy.
Right.
You don't have a heart attack if you're healthy. So even the nerve pulses that go to the heart could be indicated that there's a vertebrae misaligned and pinching of a nerve, and the body couldn't communicate correctly.
Yeah. Yeah, I'm actually due to get in. I got to make an appointment. But you think about it, you are a tube. But you're a tube that's surrounded by muscles as well. What's trigger point release?
Trigger point release is basically going in, and where the muscle has been contracted or tightened, you can release it, and that'll allow the vertebrae and the spine to go back to its normal position.
Because sometimes the muscles which have memory keep that kind of pulled too tight.
Right, absolutely. And it sometimes can be tender, but the way you feel the next day is amazing.
Scott, give us your address for your office.
3821 Washington Road, and that's McMurray, PA, and it's in the Palm Building.
Right past Donaldson's Crossroads.
Right past Donaldson's Crossroads.
Yeah. You know, I thank you so much. We're actually at the end of the show. I thank you so much for coming on, readjusting your schedule to be able to get on and explaining this procedure. I tell you, when we're off set here, I'm putting a call into my friend and telling her about this procedure for her concussion from the car accident.
Great, I'd be glad to help her.
I want to extend an invitation for you to come on the radio show on AM 1250, Healthy Pets, Healthy People, so people can actually call in and talk to you, which is a luxury we don't have on this recorded show.
Would love to do it.
So that's open. We're going to get you scheduled. Remember, a healthy pet is a happy pet. When you're healthy as well. And Dr. Scott Anderson, chiropractor here in Peters Township. Also, you can hear us live every Saturday on Healthy Pets, Healthy People, AM 1250. The Answer, that's 9 o'clock. Thank you so much. We'll see you next time on Healthy Pets, Healthy People, Healthy Owners. Bye-bye.